we'll call to order the Board of Health meeting, September 19th, 2023. We are conducting this meeting as a hybrid meeting. So we've got in person in the room, Director Deneen, and then 3 board members. And then on the Zoom, we've got Dr. Randy Kring as a board member. And then,
well, we have Pari, who will be our tobacco control agent.
oh, perfect. Okay.
And I don't know Celeste. Celeste's a new visitor. It's a member of the public. And Eric Sims, our sustainability director.
Okay, perfect. Okay. So the meeting's open. The first item on our agenda is the climate assessment request from Eric Sims. Eric, do you want to address this quickly?
Sure, I'd love to. Good evening, everyone. Thanks for the opportunity to speak with you. I know you have a full agenda, so I'll keep my comments brief. In a nutshell, I'm here representing the Climate Action Committee this evening. One of the current priorities of the committee is to have the town engage in conducting a climate vulnerability assessment. As you can probably guess, a climate vulnerability assessment explores how the town is vulnerable to the impacts of climate change across a variety of sectors. Unlike a hazard mitigation plan, which we already have in place, that typically relies on historical data and trends. And a vulnerability assessment uses climate projections from models to best assess future climate conditions and impacts, and provides a framework for strategic planning and response to those impacts. Sectors can include the built environment, so buildings, transportation, infrastructure, can include the natural environment, agriculture, and certainly public health, among others. Obviously, there's strong connections between climate change and the future of public health for the town. A few examples include extreme temperatures and the impacts of those on health, infectious diseases, and even mental health. Climate anxiety is a real thing. Not to mention considerations of how these factors and vulnerabilities can impact different segments of the population differently. So, for example, elderly people might have, be much more prone to suffer from the impacts of climate change. At this point, I think you've all received the document that the Climate Action Committee has put together, which sort of outlines their argument for the need to do a climate vulnerability assessment. At this point, the committee and myself were reaching out to engage with other relevant boards and committees to raise awareness of our intention to move forward with this and hopefully create collective support around the effort. The Climate Action Committee really thinks this is important. It goes across a lot of sectors, and are really hoping we can get some explicit support from others on the importance of this. So the Climate Action Committee will take the lead on this effort. But as I said, obviously other interests in town are going to need to be engaged and involved in this. The scope and the cost of doing a vulnerability assessment can be fairly large. So the effort will likely be done in pieces. So for example, a hydrologic study of the town, can help to inform things like zoning and development and stormwater, and environmental conditions, potential environmental conditions. Forestry study could be something that's included, forest cover for the town, which has a lot of important environmental and climate impacts, or an agricultural study, or it could be something related to health. So our intent is to pursue external support on this as much as we can through grants, but we may also consider going to the town for some funding through the budget process at some point. And as I said, really at this point, we're hoping that the relevant boards and committees will consider sharing some statement of support, general support for this effort in principle. So obviously we're not asking anybody to endorse anything specific at this point. We're just hoping, again, to demonstrate, just the opportunity for collaboration and general support across the board for this. I'm happy to take questions if anybody has questions. Again, I know you've got a busy agenda, but yeah, feel free to ask any questions or ask for any clarification.
Sure, that's great. Thank you, Eric. So I saw the draft recommendation letter to the select board, and it had like an August blank 2023. So I guess I'm just wondering, have you already issued this to the select board at this point, or is it still kicking around?
No, we have not. That was sort of a tentative draft date. And it's obviously it's a little tricky to connect with all the different boards and committees, especially over the summer. So no, nothing's been submitted to the select board yet. And we're sort of discussing a little bit more about the particular approach with the select board. I think initially it's been suggested as a recommendation that might shift slightly to more of an update than asking it as presenting as the recommendation. I think we're maybe a little more inclined at the moment to realize that the select board is probably already offering their support by the creation and support of the committee to move forward on items like this. So it may be more of providing them with an update and hopefully demonstrating that there's a lot of interest and support across the town from a lot of different sectors to have this move forward. So I think what we're doing right now is looking to see if we can garner some of that support, and then collectively we'll take any statements of support we might get along with the document that you've seen, and in one way or another share that with the select board.
So back in 2018, I participated in the previous municipal vulnerability assessment that was done, along with there was a work group that Susan Rask, the previous health director, and I participated in. It was a full day workshop, I recall. And I just remember, what stands out was remembering that all the equipment that is stored right here outside of this building, emergency response or construction equipment, was all really vulnerable if that river rose. All buildings like this are right here in the floodplain. So I remember doing this. The health department was fully in support at that point. I'm just wondering, do you have a vision of what this process would look like? And would you be including not just our support at this phase, but at a later phase as well? What does it look like?
Yeah, absolutely. As I mentioned, I have a feeling that this is probably going to have to be done in phases or in pieces, rather than trying to tackle a lot of different areas at once, largely probably because of costs and resources. The Climate Action Committee is working on trying to narrow down what some of the focal points would be for starting on something like this. So say, for example, I mentioned a hydrologic study. Concord's very prone to flooding. We're seeing more intense storm events, more precipitation, and we'll see more threats of flooding in the future, which obviously has a lot of impacts on the town in a lot of different ways. So we're kind of thinking that something like a hydrologic study could help to inform a number of different areas and might be a good place to start. But regardless of what we focus on, we would certainly be engaging any relevant stakeholders in that process, both within the government, within town government and boards and committees, and also any external stakeholders on as part of that process too. So so even though we're sort of asking for these statements of support and principle right now, we would certainly be working more closely with all the different boards and committees and other stakeholders as we move forward on different pieces of this.
Do you know if anything ever came out of the work done in 2018? I mean, I saw in the documents you sent, the sustainability principles came after that, and there was some follow-up, but was there anything concrete beyond that?
I don't think there was a whole lot concrete in terms of actions moving forward. I think that helped to inform the Climate Action Resilience Plan, which we now have in place. So I think that was certainly part of that process, was thinking about that as the Climate Action Plan was developed. I don't have all the historical context of that, not having been here long enough. But I do think it was important in that process. And I think what we're hoping to do now is really get into much more detail and dig a lot deeper. I think the first thing we'd be doing is looking to downscale regional climate models as much as we can, to look at what the the data and the future conditions are expected to be, and then start looking at these particular issues in the context of that for planning. So, I mean, obviously there's a lot of direct implications on a lot of fronts, but we also see this as being an important planning exercise and tool for the town in terms of strategic planning, capital budgeting. How do we look at investing moving forward for the town in a lot of different ways. I mean, it even goes as far as I think may have been mentioned in the letter that rating agencies are now beginning to ask municipalities what they're doing on this front in terms of considering what their ratings are. Obviously Concord has pretty stellar ratings, and historically has, but it just goes to show that this is becoming more and more important in the eyes of a lot of people.
Okay, so I guess, I mean, this was sort of drafted like a letter supporting your recommendation, but the recommendation hasn't been issued yet and might get tweaked to not be a recommendation, but be an update. So I assume you're looking for something like this, but a little different, that just sort of says we support your efforts on this or something like that.
Yeah, I think that's fair. I think some committees have sort of taken that draft letter and modified it to meet their needs. Others have chosen not to put it in a letter format and want to send an email with a statement of support. So I think it's, I think there's flexibility in that. Obviously, if you were to do that, then whatever format you would feel comfortable with is fine.
Okay, so let me put it out to board members, I guess. Any discussion, opinions on, some kind of a statement of support?
I certainly feel we should, I can offer support. I mean, I feel like we should be doing that. In terms of specifics,
I wouldn't worry about the specific. I think if everybody votes to do some kind of a statement of support, I think we can just in the vote say that, like, between Melanie and I, we'll figure out what it says and submit something. But I don't want to assume. So I'm just making sure everyone is, before we vote on that, if everyone's aligned, or if people have questions or concerns about doing that.
I would be supportive of a general statement of support.
Yes, agreed. Same here.
Okay, so
So I would motion if appropriate for the Board of Health to agree to provide a letter of support or whatever format would be preferred to support the Climate Action Committee.
all right, is there a second?
I second.
All right, all in favor, and we're going to do roll call since Randy's on the Zoom. So, Dr. Kring,
Approved.
Joe Block, Kurt Herman,
Approved.
and I'm Mark Haddad. I approve. Great. All right, thank you very much, Eric.
Okay, thank you very much for your time and your consideration. I appreciate it.
Is there a deadline you need this by?
No, there's not a deadline. I mean, I think we're probably close to finishing with in terms of communicating with committees and boards. So I think once we feel like we've hit everyone with our request and have what we need in hand, then we'll consider how we want to move forward with the board. So I wouldn't say there's a sense of urgency in terms of the next few days, but the next week or two or something like that, I think would be fine if possible.
Okay, perfect. Okay, all right. Thank you very much.
Thank you.
For the next variance, Deborah's Natural Gourmet could not be here. They're actually at the Taste of Concord event.
Yep.
What you have before you is the variance that was issued in March of 22, right before I started working here. And it was with the understanding that you would review it in March of 23, which we did not do. So this is the document. The purpose for today is to review this The applicant has submitted another request to vary from this, that's still under review by me. I didn't get it in time to respond with him, and correspond and have him come. So he's intending to come next month with his proposal. I have not yet determined if I'm going to support it or not. He's probably gonna come either way.
Yep.
But that's where that's at with his request. That's outside of what's laid out here.
Right, so this one would just be to keep the variance that we already had approved in March 2022, just to renew it. And as far as putting aside how well they're complying with it or not, which is sort of a issue for you to deal with them, is there anything from this that gives you concern?
I'm comfortable with this variance as it's written. Jill and I actually participated in a conversation with stakeholders from the state and throughout the country with the action and interest of individuals and groups with use of containers. There's a lot of growing interest, and this was a model that was actually asked and requested, and we shared.
Yeah.
Okay, which is actually brought it to my attention, right?
Yeah.
Right, we was
Very
reviewing
cool.
that, when we saw that it said.
But I was like, oh,
Yeah.
because I had not laid eyes on it and did not know that it had an endpoint. And that's why I had asked Jill to participate, because they'd asked about the process and how that was implemented, and I couldn't speak to that, so I'd asked Jill to participate.
Yep.
So I thought she was a better resource to speak about the variance, and it worked out quite well.
It was really good. It was with the Center for Biological Diversity with their National Reduce Network, and it was the Municipal Waste Reduction Programs from the Department of Environmental Protection, because we had submitted a letter to them when we issued this, and they actually used it, that's what brought it to the national attention, I believe. And so we were one of 3 presenters in this conversation, and we were really like the only one that they wanted all of our wording. We were the model, which was very cool. But I mean, I can tell you a little bit more about this, because if you go into Deborah's now, when you go at the cash register, this is the sign that is posted on it, which says, in 2021, the Concord Board of Health granted us a variance to the state health code so we could allow our beloved customers to bring clean, reusable containers from home to fill with bulk foods. Otherwise, we need to use a new disposable plastic bag each time. We are the first store and Concord the first town in the state to legally do this. However, it has been brought to our attention that the variance does not allow plastic yogurt containers. Apparently, there's a gray area around their durability, keyword in both a regulatory and practical sense. To be clear, this isn't specific to yogurt, but any kinds of finished, softest plastic originally used as food packaging, which may potentially warp in a high heat dishwasher. We hope to resolve this soon. We are applying for an amended variance rewritten to explicitly allow this kind of container. However, for the time being, we cannot sell food into them. Thank you for your patience and understanding, and thanks to the Concord Board of Health and Health Department for helping us navigate this tricky territory. So that's a heads up about what he's going to ask us for.
Yeah, he's asking to use plastic yogurt containers.
Or like anything that you're getting from
Any
takeout.
reusable takeout container. So I.
Right now it's glass, metal, and is
Mhm.
that right?
Mhm.
Okay.
And there's some plastic.
And durable plastic like Tupperware,
Durable
not
plastic.
sort of temporary
Yeah.
plastic.
And apparently, I mean, they put up that sign because a lot of people are coming in with their yogurt containers or
Yeah,
whatever.
They were not in compliance possibly until I spoke with him
Mhm.
and said, have you read this? Yeah, he was not, we were working towards that. I had another business call me and said, hey, Concord, we can use temporary, call me. Is it true that we can use containers in Concord? And I said, yes and no. It's true because a business has a variance, but the answer is no, you cannot unless you're going to wash it on premise. And he was that, so there's a lot of individuals in the community who are looking for that type of, reusable food packaging. And this particular other business I'm referring to, we had a good conversation about the contaminants and rancidity and moisture, and for their product, he was not looking for that. He was looking for me to say, no, you can't use that and why, I said, you can, you're just gonna have to apply for a variance for the Board of Health. I'll share you the other one, but here's your considerations for your product. And he's not applied yet, so.
Yeah, so one minor thing in the variance, because it's the existing one, it specifically refers to Ms. Stark
Yeah,
in
it
that
needs
number
to be
5, so
amended.
that should be changed to be
It needs a date amendment, it needs, that be directed towards him.
yeah,
Um,
okay.
and I would probably put my name on there as a person to
Yep.
contact, as well as Gabby's.
And then would you be comfortable if we did this for 1 year from now?
Yes,
Is that, okay,
I just want to be transparent with, I believe he'll be back next month.
yeah, no, understood, understood.
And that we'll be
Trying to
talking about
amend
this again, but
Yeah.
he felt that this was, we agreed that this was a interim, shall not be out of compliance because it was technically expired.
Right. Okay.
Mm-hmm.
So does anyone have any other questions or concerns on this?
I'm sure we'll discuss this in a future meeting, but just curious, what led to the discussion of not allowing the plastic containers from the beginning, in the current variants. I don't know if there's any record of the discussion or
Sure, there's a lot of.
logic behind that.
So in the food code, there's a definition of reusable. So a reusable container. I don't know what discussions Jill and Mark will have to elaborate on that. But from a technical standpoint, it actually disallows reuse, people using their own containers at all. In the code.
I think the concern about something like a yogurt container is that it can't withstand, it's more likely to just deteriorate from the repeated hot heating and washing, but it's not meant for that kind of repeated use.
If I go into a restaurant and we see a reusable food container, like a pail or a bucket in use, it's not allowed. They have to have a container that isn't subject to that contamination. So a type
Gotcha.
of harder, high density polyethylene plastic or metal, stainless steel, is what we're looking for. So that's the same across the board either at retail or in food service.
The issue is intended use and performance.
And how the plastic, the possible contamination.
Mhm.
He will tell you he's adding dry goods. Like the argument and the flip side is it's not a high moisture TCS or food that's going to be subject to the flavors or whatever. If you had garlic in that container and you add flour to it, you're going to have garlic tasting flour, but this customer is going to take that on their own risk. Right? Like those plastic products do have flavor and compounds that you can't get rid of. So there is some contamination, if you will.
And color too, like spaghetti sauce.
Correct.
stain.
Like, I mean, you all probably have those at home that you've done this to, right? And so you kind of know, but from a very microscopic level, that also happens with flavor compounds, with bacteria.
Yeah.
And that's the reticence and why it's prohibited in code. California has allowed it. They have another regulation that has gone the other way. And the Conference Food Protection is always talking about it. And that's the regulatory body that feeds into the food code.
The group that we were talking with, the Center for Biological Diversity, their goal is to change the federal food code.
Right. Their goal is to be where we're at, or even
Or
where
even-
Mr. Stark is at.
Right.
It gets down to what's the definition of a reusable container.
Thank you. That's helpful context.
Okay, so more to come on that probably next month, but in the meantime,
Should
I'll-
we
I'll
vote for this?
entertain- Yeah, I'll entertain a motion. Someone will move to approve renewing the variance for from today through, I'd actually say from when it expired in March through a year from now.
So you're
Um,
thinking September of 2024
No.
or March of 24?
No, so I think September 2024, I'm just saying, I think we should approve it to go back to when the other one expired.
Okay,
Is all I'm saying.
Retroactive approval and going
Yeah.
forward for a year.
Extension.
Well, we're extending the existing variance through September 2024. And then with the few changes you mentioned, which is to change the name and add your contact information. Does that make sense? So
I
what do I
that
move?
We
Yeah.
update with that we, I move that we update and extend the variance, to use and refillable returnables for Deborah's next door with the, removal of Deborah Stark's name from it, additional, information on Melanie's contact information. What did I leave out?
the date was September
Uh,
24th.
Extending it to September 2024.
Okay. Do we have a second?
I second.
Right. All in favor, we'll do a roll call again. Dr. Kring,
Approve.
Joe Block,
Approved.
Bert Herman,
Approved.
and Mark Haddad, I approve. Okay, thank you. All right. So Melanie, the next time, do you want to introduce Carval?
Pari,
Yeah,
how are
hi.
you?
I'm good, thank you,
Uh,
ma'am.
So
are you?
this is Pari. He is currently the tobacco agent that is working on we're on a tobacco grant with our Metro West Tobacco Control District. And I have in their packet with some information that I'm going to send out to our 14 tobacco permit holders after you appoint, we're looking for you to appoint him as an agent to the board. Do you want to speak?
Hi, my name is Pari Vallal Telegovindan. You can call me as Pari. I'm based in Framingham, Department of Public Health in Framingham. So I'm the new tobacco control program manager for the Metro West, which includes 16 communities, including town of Concord. Yeah, so, excuse me. We'll be having the inspections, the two routine visits. So one will be the routine inspection and educational visit among the tobacco retails in Concord, and the compliance visit, which will be done with the trained youth. And that will be happening by the end of November. We are collaborating with HRIA for the compliance visit. Yeah. And once you appoint me as the tobacco agent, a package will be sent to all the retailers introducing myself and about the program. And they will be trained on the local Board of Health regulations and the state regulations. Yeah, if you have any questions, please let me
Great. So Melanie, so we had someone else
So
previously, so
that-
now we've switched to this.
So that grant dissolved and
Okay.
they went to their public health excellence. They were in a different group where we are Great Meadows. And
Okay.
they dissolved and used their public health excellence grants for tobacco control. So we joined Sudbury. Bedford and I both knew Bill Murphy, who's now the director, and we joined. And as is most of the Great Meadows Collaborative, we're all
Yep.
one big. You can see Pari
That's
has
why there's
quite the list,
16
but
towns,
Pari has
yeah.
quite the list of towns that
know.
he's.
Yeah, still more are adding.
Yeah, we're
including-
all joining one big tobacco.
Right,
That person that was the tobacco control agent is now the assistant health director in Bedford.
okay,
So Marissa
Got
took
it.
the assistant health director role. So that was a next career step for her.
yeah, okay,
So, and that at the end of June, that agreement is dissolved.
okay.
Okay.
So the only question I have is, there's a few tiny things that are different with our tobacco regulations and like the state one.
Yeah, he knows.
Okay, so
Apari has a copy of our
when
regulations.
you do the compliance, not the, I mean, the compliance is the 20, but when you do the routine inspection, you'll be looking at those things.
Yeah,
Right.
I'll be having a copy of Concord BOH with me. In case they need a copy also, I can provide them, but I'll be training
Yep.
them both Concord BOH regulations and the state regulations.
Pari actually
Great.
did a synopsis and he gave me a report of how we vary from the state and wants me to update our regulations again.
Okay,
So I thought we were in totally alignment with the state. So that's another Board of Health meeting.
okay.
He said, this is how you're different from the state. And I was like, what? I thought we aligned with the state. So I
We
haven't,
had an expert come do that.
and I really,
Okay.
so he had a whole sheet that is on my desk that is
Okay.
me going back to Cheryl with
Got it.
like, okay, let's go back
Yeah.
and revisit. There's a couple of tweaks.
Okay.
To align and then include but Pari has a copy. I met with Bill and Pari last week. Was it last
Yeah.
week?
Yeah.
In my office, and we talked about our tobacco agent, our establishment that's out of compliance or had been caught, and anything else unique to Concord. So we got to see each other in person and then kind of set up the next step is for him to be an agent for the board so we can act and enforce the code in our local regulation. And
Okay.
then kind of let you know the reports or like what he does moving forward if there's any issues.
Okay. So that all makes sense to me. So I'll entertain a motion if somebody is, we'll move to approve Ari as our agent for these purposes.
I move to approve the appointment of Pari as agent for the Concord Board of Health.
Thank you.
Second.
All right, all in favor, we'll do a roll call again. Dr. Kring,
Approve.
Joe Block,
Approved.
Kurt Herman,
Approved.
and Mark Haddad, I approve. Great. Thank you very much, Pari.
Thank you so much for having me. It was a pleasure meeting you all. Thank you, Melanie.
Thank you.
Yeah, thank you, Pari.
Just us. So chair and board member reports. So I don't have anything other than, I emailed each of you separately. So the chair's breakfast is tomorrow. So it's good. It always happens after this because I can get the update here and know what to talk about. But then it's bad because then it's a whole month before I can tell you guys anything interesting, if there's anything interesting. But anyway, it's tomorrow. But then there is a like governance DEI discussion that's happening at 9 o'clock right after that, which if people are interested and want to attend, it's open to all board members, not just one representative, although I think it's in the same room. So I don't know how they're going to fit people if a lot of people show up. But just mentioning, I had sent you an email, but if anyone's interested, you're invited. Feel free to come. And there was like a RSVP form, although I don't know. I don't know that anyone's checking attendance and it would not let you in if you just show up. So, other board members, anything?
I was gonna tell you
You
about
want
what
to
we did, but
discuss?
it's already,
Sorry,
it's already there. No, it's great. It was actually, what was interesting about that also, yesterday, Governor, Healy announced the ban on, for the state cannot purchase single serving bottles, plastic bottles. So that was announced. And in one of the articles that I read about it, it cited Concord as the, the forerunner and all of that. So here we go. We get to be the leader in all of these reusables or bans on different products. So which is kind of cool. So I was happy to hear that. It was just about the state agencies couldn't purchase those. So it's kind of limited. It wasn't like you couldn't sell.
Yeah, well, right. Well, they're not making it illegal. They're saying
Right. The state
they're
agencies
right.
can't
So if
purchase
each
it.
company would sort of follow suit, you'd have a big reduction.
Right. But we were definitely cited in that, and here we were in this national call, so we're at the forefront of this stuff. It's great.
That's awesome.
Any other-
I wanted to thank Melanie for engaging with Emerson PR, as it were, in regards to the Best Western shelter. I had someone from Emerson PR reach out to me, kind of asking for updates and information, and I directed them to Melanie, and they reached back out to me afterwards saying how helpful she was with getting that information. And it's the hospital, I think, is trying to figure out how it can engage and be supportive of the system. So getting information shared is very, very helpful. So thank you, Melanie, for that.
You're welcome. I thought it was a good conversation. I just have to have more with Emerson.
Yes, indeed.
Did you want to talk about our naloxone? Do you want me to report on that?
If you would, that would be great.
Okay. Oh, wait.
Thing, Starmet or otherwise?
Only that we're planning on having a public meeting for the 22-29 Main Street Advisory Task Force this fall, which will be after EPA's public meeting. I think EPA's is in October and the task force is in November, really just to listen to the community's thoughts on potential acquisition of the site and any concerns they might have.
Got it. Yeah, I've noticed that's been making like the Concord Bridge. It's, it's a,
Mhm.
it's an item of interest at
Yes,
the moment. So
it was mostly accurate.
Yeah, I live next door to Henry Bain, our select
Oh,
board president,
okay.
or chair, so
Yeah.
he cornered me on this one day.
What do you
think? Told him my personal opinion, just that I said, I don't think anybody would ever agree to having, even though it's being brought up to residential standards, I said, I don't think
Yeah.
anybody would ever really want to live there. So that was my personal opinion on it, but I didn't say much more than that.
all right.
Okay.
Melanie.
I have a lot to say, but I'll try to be timely.
Okay.
First order of business, personnel. Karen has officially retired effective September 30th. We have a 30-hour a week Robert Half admin. Her name is Elizabeth Lagoy, that's been filling in Karen's absence. We will miss Karen greatly. Her wisdom and her, her work in our department is you can't fulfill those shoes, right? It's impossible. I do have a card here, and it will be in the Board of Health if you want to sign, come by and sign. I don't have any details on her retirement yet because I haven't had a chance to speak with her and find out how to coordinate all that. But if I do, I will share that with the board. Moira Carter is a public health nurse. She starts Monday, 25 hours a week in Concord and 15 in Maynard. It's a joint position. Moira is a RN. She's also a nurse practitioner. So I'm looking forward to her skill set and what she can bring to us in support of working with the shelter, with the council on aging, and on our residents. So there's a lot of, it's a new position. We haven't had that position yet, so I've been working on that onboarding. Let's see. Gabby's still out on workman's comp. She's working remote 8 hours a week. So I'm a little bit down staff, trying to work with our manager's office on budgets and what I can get for contractors in to accomplish our minimum standards, including we have a contract that's been signed with Boardman Animal Control for the fall barn book. That's a required for you new folks inspection submitted to the state. It's kind of separate from our animal regulation, but we tend to inspect them at the same time, right? We look at our animal reg, but we're also there. That's the annual log of farm animals. It's a very old Massachusetts regulation that's ongoing. So that's been signed. I'm working on starting a food inspection contract to get the rest of the food inspections for the year achieved. I think that's all for personnel. I did have an opportunity to talk with the hospital, like Dr. Kring mentioned, but also get interviewed myself. And it was on the radio, public radio, about the shelter.
You should have told us so we could have.
I'll send it out to you. It's a link. Specifically around the work that we did around getting the vaccines. So the questions were about what Dr. Kring did, Dr. Green, how we collaborated to get the kids into summer camp. and what that efforts that took. Moving forward, the region is working on getting vaccine. The state is also simultaneously now there's a Vax bus that could go deliver vaccine, but at the time in May and June, it wasn't available. So we're working towards a number of different solutions, both at the state level and the local level. So that was what, yeah, we spent some PR on. The other thing I wanted to share, been pretty active. Dr. Kring graciously agreed to sign his signature, so we now I can obtain naloxone. And so we can have training and distribute it as a board of health. So I have some upstairs. I haven't received permission from the state. I got it through the region, but I'm working, now we're a dispensary, but now I have to go get it. So it's all in virtual space with approval, but we're working on that. The first order of business the town wants to have a training for employees. And it's all working with the opioid, awareness.
Was that
And harm
with a
reduction.
DEA license?
I went through the state.
Yeah, I mean, you're more than welcome to use mine. I'm happy to be the sponsoring physician, of course. And remind me, Melanie, on the form itself, though, you were saying that it is the state's something to do with the state authorizing, or
Yeah, so a physician had to but it's like the Board of Health, Concord Health Division is the one, but it was like we're connected, right? He's on our board.
Right.
So it's like we're like twinsies. It is a state license for us to have it here. I can't remember what the license was. Sorry, but we now have one. I can look it up though. That was just trying to get product here to then distribute. The product that our first responders have, they have to account for. Like if they give it to somebody, they have to write down who they gave it to. And in public health, we want harm reduction. It's like, take it, we don't care what your name is, right? That's a very different philosophy. And is to little to no money for we have a good amount of opioid sub money. So this is a direct harm reduction, task that we can do as part of our training. We also Jill met with another member, our grant coordinator for public health excellence last week, to try to outline how we're going to use the naloxone. We have a 3-pronged plan. One is to work with our public health collaborative that meets, the next meeting is on Wednesday of next week. First, we're going to pursue a public health needs assessment. So use the data. We have quite a bit of data out there, but try to hire somebody to really look in to what we need and what's out there in their community. Second, probably recommend about a 10-hour-a-week position for substance use prevention, using the opioid settlement monies. And the third step will be to develop training on naloxone, like have a contractor or be able to, the person we met with, Kelly Kahlo, she'll develop a training to go, and people in the community could request their group. We had a request from Concord Rod and Gun. Can you come do a naloxone training and give out naloxone? Well, we'll be able to have it, and then we'll have somebody that's available to do that. And we'll have a contract that they're for X number of dollars, and then the money will come out of the opioid settlement monies to pay for that type of training. And the idea is our needs assessment and our collaborative will help inform our next other work we need to do. We're just kind of getting the ball rolling on that. So that's with opioid settlement monies. As far as inspections go, pond is closed, the pools are completed, the camps are done. As Mike and I have been a team of a dynamic duo here all summer. And the next step is really focusing on septic is picking up. So we had a pretty slow since Mike started. It's been only about less than one deep hole, so soil evaluation a week, and we're up to 2 weeks out, 2 or 3 a week. So it's been almost a year of Like when I first started, I was out 3 days a week, right? Doing the deep holes and then the, 4 to 5 inspections every afternoon with installs. It's different stages. And now it's been really slow and it's kind of picking up again. This spring in Lincoln was busy, but now Concord's picking up too. So I don't know the dynamics of that. There's a lot of people, not a lot, but increased number noticeably putting in ADUs. So the regulation at the building inspector and zoning is now passed. You can put in an ADU. But what people don't seem to remember is that they have to have a septic system big enough. So they have to do a building review. And then we tell them, well, your septic system, a real ADU is a minimum of 3 rooms usually in design flow that you're adding to a septic system. So some people end up having to put in a separate one. So we have some of those going in specifically for the ADU, or they have to decide if they can, choices they have to make, deed restrict or put in a new septic, because they're typically, a lot of them aren't really big enough. Very few, unless they've planned in advance for this, very few, because a lot of our septics are 4. There's some, they're 5, but then if you have a 4-bedroom house and you're adding an ADU, it's just not, you're over 6 bedrooms. So if you go from 4 to 5, we'll deed restrict to 4, but if you're going from 4 to 6 bedroom design flow, I reject it.
Right. What happened
Well,
with?
they could appeal to you. There's a couple that have wanted to appeal, and so that could be coming. There could be more that say, I don't agree with your decision. Mike does the review, I do the appeal. That's our process. We're kind of ironing out. And then third step, and we had somebody last month that almost came and then changed their mind. They could then appeal to you. They could comment to you and say, I don't agree with this. This is why. Arguments like we have 2 people in this house, never have flown. But that could be happening. That could happen with the room counts and what people are labeling as a bedroom or a room.
Yeah, so the person who withdrew it, and so then we were able to.
They would do it because they
August.
removed a wall. They took a
Yeah.
room down in the basement.
Oh, got it.
They
They
had-
came up with a different.
Yeah, they had, typically in basements, if it's 1 room, we call it 1 room.
Yeah.
Unlike a living space upstairs, if it's 1 room and it's a living, kitchen room, dining room, we count it as 3. If it's clearly like a living, kitchen room, dining room, sometimes it's only a kitchen, living room, we call it as 2. Trying to be as fair, consistent as possible. It's always a little bit, but when we count kitchens, some people think we don't count kitchens, we don't count mudrooms, and if it's less than 70 square feet. Some people have some pretty big closets. We don't count closets either.
Right.
So
Okay.
So we're using the definitions in Title V, pretty specific, so it gets down to, and then just our conventions of what we're trying to be fair and consistent of, working with industry, what they're telling us and but sometimes people, they'll have 4 bedrooms on paper, but it's actually a 13 or 14 room house. Then once you're over 8 rooms, the code says you divide by 2 to get the number of bedrooms. So they'll tell me I only have 4 bedrooms, and I'll say, well, you have 13 or 14 rooms. That's, either a 6 or a 7 room house, bedrooms, design flow. And if it's more than 2 greater, I deny it. In a lot of cases, the ADU is another bathroom, another kitchen, a laundry. So you're hard pressed to not call that 3 rooms. It's not 3 bedrooms, but 3 rooms. Like really, it's another whole person doing another whole set of household things. More on that. If anybody has input, we're kind of working through that. And I think that is essentially the gist of what we're doing. We're trying to get day to day. We're working on staffing. I'm going to the MIHA conference this week. So the Massachusetts Environmental Health, the regional called the Yankee Conference. So Maine, New Hampshire, Vermont, Connecticut, Rhode Island. So every year in the fall. So I'm going to that the rest of the week.
You get to actually travel for it?
It's in Northampton. So I'm going off Northampton. I call that travel. Any other questions?
Not on those things. I think, you should also talk about cell tower.
Oh, I had, yes, thank you for
And
reminding me.
also the email from, Brian Folds with the light board.
Okay. What did I do with that piece of paper? On the 19th of October, they are having a public hearing on cell towers. There, it is a public listening session. And I sent it all to you in an email. Another thing I wanted to have you guys discuss is the feeling of radio waves and cell towers. And what boards of health can and cannot say or should and should not say about response to them and their health effects, which I sent you the MAHB board of light reading, Dr. Crane, when you're bored, about boards of health and their responsibilities. But on page
I had
127,
never seen that guide. I was so happy when I opened it, actually.
you were?
Yeah, I was like, I'm a lawyer.
He would love it.
Yeah. I was like, oh, this is great. This is like all these questions I always have, like, they're all right there.
That's a good document, and I
Yeah.
would be remiss to not say, oh, I should go back and look at it more often, because there's a lot in there.
166 pages of it.
There's a lot in there and a lot of good guidance, but some pretty specific technical guidance on, in the section I referred you to,
Okay.
on radio waves and the data from Europe and what they're saying. It's and what not to say.
Right. Well,
Um,
very specific guidance that it's all federal preemption, and so we can't. Health is not a basis for a municipality to turn down
Right, and that's been
a
Yeah.
tower.
through litigation, like it's been to
Yeah.
court, so that's well defined.
It's
So-
pretty clear from the guidance you sent.
Yes, and that was what, I worked with Chris Carter in risk assessment in the town manager's office, and he said, your board, and people are gonna be talking about this when they're looking for a place for the cell tower. And ask your board to have weigh in, and certainly the listening session is invited to go. The deputy town manager invites you to come, but also to know that there's like legally what you can say or what is it been, I guess, established. Right? You can say whatever you want as a person, but as
Yeah,
a
we can
board,
say, you can say what you want as a citizen, but as a board, we should just stay away from it. is
that's kind of what the gist of it says to me.
Yeah.
Um,
We can only make it worse instead of better if we say something. I think is my take.
right.
Is it fair to talk about other public health risks from not having cell phone communication in the town?
Well, I personally don't get very good cell reg, so I would think there's a lot of, I'm supportive, very biased support of having good cell phone.
Because I've mentioned that as in just a private context is my concern, having two high school daughters
Yeah.
and I can't get in touch with them.
It's a public safety issue,
Yeah.
public health issue.
I find it a limiting factor when I have to make a personal call during the middle of the day, during the work time. I can't really get through to my child's school, to your point. Like if something's going on, I'm conflicted. Am I gonna call on the Concord line or try to get a broken signal out underneath the tree?
I had the same experience just trying to get through to the high school, so.
Yeah, so that's what I think we're all kind of faced. And Mark, I do not know what you're saying, light plant, when I missed that
No, you
memo.
might not have seen that email. That was,
I'm gonna admit to not knowing.
yeah. Well, that just shows you're very busy, which I understand.
So,
So Brian Folds is the chair of the light board. And he sent an email on Saturday that you were copied on.
Okay.
And that Mark Howell then sent to me on Saturday also. I think as a first step, maybe just send the email from Brian out.
I'm
to the
gonna
full
for-
board. Yeah, you could,
I have it flagged.
we have
funny,
this
and I-
issue, like you can forward to everybody and I can't. So
Right,
that's the-
I can send this out to the board, but I have it flagged, but it's only Tuesday. I haven't read
Yeah,
it.
yeah.
I go through the flags, but not yet. Saturday. All right, I just sent it to you. You all have it.
Yeah, so basically the summary is that the light board is being asked by someone to hear a presentation from an engineering firm on how to mitigate it says efforts, but I assume they mean effects of electromagnetic interference on human health. And then he is basically turning around and asking us, he's saying, I'd like to ask the question of the health board or appropriate town expert if electromagnetism harms human health or if studies are inconclusive, blah, blah, blah. It says if the Concord Board of Health or relevant town expert field electromagnetism should be managed to reduce any possible harm to human health, the light board and light plan are willing to take action to mitigate. I mean, it feels a little like passing the buck. Like, I think they want to be able to
Totally.
say,
So,
you know, if someone tells us we have to worry about this, then we'll worry about it, but we otherwise don't necessarily want to be having to worry about this. So, and this, you may remember, because I think this did come up at Board of Health meetings, the smart meters. And so again, in his email, he talks about when the same citizen and, you know, others raised the concerns about the smart meters, that they went through the effort of having analog meters for certain houses that opted out and things like that. But anyway, I don't know that there's something for us to, there's certainly nothing for us to do tonight. I just want to make sure that you all know about it, and you know, potentially we should talk about it again at the October meeting, even if our decision is just to not pursue it. Although if somebody's interested in this topic and wants to look into it, they certainly can. I don't think that as currently staffed that Melanie has bandwidth to spend any time for us to be looking at this. She has to focus on cheese still.
I do have the cheese
So,
people. They will be here.
yeah.
They will be here.
Next month.
With a new variance or revised.
Yes, I met with them and they are supposed to have a new variance request, but they're supposed to submit it to me before the meeting. And on my to-do for the list is to schedule a meeting, an inspection with them to make sure that happens before the next meeting.
So anyway, I think that's it on cell towers and electromagnetism, unless people want to talk about it further, which, you know.
Just to frame the concern, it's a concern for private or municipal solar panel installations, or just in general?
I don't know. I would assume it's probably more about municipal, or like the middle school, because I sort of feel like, I mean, I have solar on my house. It's kind of none of anyone else's business. Like, what does someone else care if?
Yeah, that's what
You
I
know,
was getting at.
So, but I'm not really sure. We just have this email.
Okay,
All
right, I'll look at it more closely offline, but appreciate the heads up on the issue.
I think I seem to remember Gail Hire might have been one of the people that was here very concerned with the smart meters when we did hear about it years ago.
Yeah, my recollection is we heard about it and we chose not to get involved.
I'm sorry, my computer froze there for a moment, so I missed the last minute, but I would just be curious if there's any state guidance to answer this question that we could maybe push or cite as rather than, again, directly getting involved. I would imagine that there are regulations in regards to cell phone tower installation, and I just briefly looked at Gail's email. The 5G, she's concerned. They're concerned about the 5G network as well, and so on. And so I could see it maybe being helpful for us as the board if we could direct those concerns to the state level. And my personal thought being that if the state allows installation of 5G network without concern for adverse effects to human health, that maybe that would put this to rest. But
I'll try to dig around, see what I can find. I'm going to this meeting. Maybe I can talk to some people. There's a lot of people there.
I have a colleague that's a radiation health physicist who I
Mhm.
can ask
That's-
just for some input on the regulations and guidance piece of it.
That would be amazing.
Yeah, I'm sure they're,
Any support, anybody wants? I'm hiring, did you know?
Right? Is that? So
That's
your-
all I
that's
had.
everything.
Yeah.
All right, let's see, if we can finish in 3 minutes, we'll finish on your agenda. The next Board of Health meeting is
Number 17.
October 17th, so does that still work for everybody that's here at least?
Works for me great.
Okay. Great. And then minutes, so Melanie circulated 4 sets of minutes. We're very backed up because it's from when Karen went out on leave, so one of them was prepared by me for the last meeting, the others were prepared by an outside service, although I think you all had a chance to look at them and I made some edits to them and things, so I think they're in good shape unless anybody has any questions or comments on those minutes, otherwise, if someone would move to approve them.
They seem to be pretty reflective, as I remember, so many months later.
Yeah.
So I moved to accept the minutes from, was it
April, May, June, and July.
April, May, June, and July of 2023.
I'll second.
Great. All in favor, roll call. Dr. Kring,
Approved.
Joe Block,
Approved.
Fred Herman,
Approved.
Mark Haddad, approved. All right. Anything else that anyone wants to cover? All right, hearing none. Do I have a motion to adjourn?
I move to adjourn.
Second?
I second.
All right, all in favor? Aye. All right, perfect. 1 minute early.